right, welcome back to the deep dive. Today we're going to be looking at personality disorders. They are super complicated and I think often misunderstood. We're going to do a deep dive. We're going to be taking a look at the Handbook of Diagnosis and Treatment of DSM-5 personality disorders, and that's going to help us really unpack some of these conditions.
Yeah. We're going to be pulling out the most important information in this handbook about how these disorders are conceptualized, how they're assessed, and the best ways to treat them.
Okay, yeah. And so starting off, this handbook, it talks about like the history of diagnosis, how we even got to this point of trying to understand these things. And it starts off with the DSM-2 in 1968. And it was so brief. Like, they didn't really say much about it at all.
Well, I think the DSM was like a little pamphlet.
Yeah.
And the DSM-2 wasn't that much bigger. So, I think that speaks to how much we've really learned about these conditions.
Yeah.
Right, exactly. And then it goes on to the DSM-3, and it talks about how this was like a game changer.
Right.
Like, this came out in 1980, and suddenly the diagnostic criteria just exploded in size.
And I think that was really an attempt to increase reliability, to make sure that different clinicians, when they were looking at the same presentation, would make the same diagnosis.
Right. And with that came the multi-axial diagnosis. Right. So it wasn't just one thing that you were looking at.
That's right. So we had 5 different axes. And the idea was that we would be looking at, what are the clinical disorders? What are the personality disorders? What are the medical conditions? What are the psychosocial and environmental problems? And then what's the global assessment of functioning?
Right. But then the handbook also talks about this ongoing debate about, the DSM in general and about the fact that it labels people and also that maybe it discourages people from even trying to understand it because it's so complicated. I think that's a really important point. And, it also doesn't really have operational definitions for a lot of the terms. Like I think one of the examples is a criterion for borderline personality disorder, frantic efforts to avoid real or imagined abandonment. So we all sort of have a feeling of what frantic means and what abandonment means.
Yeah.
But, it's not like a really precise scientific definition.
Right. Yeah, it's a little bit vague. And then because of that, there are so many different ways that people can meet the criteria for the diagnosis.
Yes. I think the handbook mentions over 200 different ways that somebody can meet the criteria for any one personality disorder.
Wow.
So I think, that speaks to the fact that we're really putting people in boxes that don't really fit the reality of their experience.
Right, exactly.
Huh.
Okay, so now let's get into some of the core concepts of personality disorders. This handbook talks about the interplay of temperament and character. So can you explain what the difference between those two things are?
So temperament is considered to be your innate predispositions that you're born with. So, those are the things that make you, react to the world in a certain way emotionally.
Okay, so like if somebody's naturally prone to anxiety or being outgoing, that kind of thing.
Exactly. So the handbook mentions Cloninger's model.
Yeah.
And he has 4 different, temperament dimensions.
Yeah.
And they include things like novelty seeking, harm avoidance, reward dependence, and persistence.
Right. So those are biologically based.
Right. So if somebody is high in novelty seeking, they might be drawn to adventure. If they're high in harm avoidance, they might be very cautious.
Right. Makes sense. And then what about character?
So character is something that we learn. So it develops as we grow, and it includes things like how cooperative we are, our sense of self and purpose in the world.
Okay, so temperament is like our raw material.
Right.
And character is how we kind of mold that. Okay. And then it also talks about the 5-factor model. So this is the idea that, people have different levels of certain traits, like how neurotic they are or how extroverted they are, how agreeable, conscientious, and open to new experiences. How does that all fit together?
So that's another model of personality traits. And the DSM-5 also includes a section on the dimensional approach to personality disorders. And it looks at 5 temperament domains: negative affectivity, detachment, antagonism, disinhibition, and psychoticism. For example, the handbook mentions that somebody with an obsessive-compulsive personality often will have a temperament style characterized by inhibited emotions, behavioral caution, rigid thinking, and being very conscientious.
Oh, okay. Interesting. So they're looking at it from different angles.
Yeah.
Now, the handbook also talks about the importance of early relationships and, especially when those go wrong.
Yeah. There's been a lot of research on attachment and how that affects our neurophysiological development, and, especially the orbitofrontal cortex, which is often considered the emotional brake of the brain.
Oh.
So when a parent is really attuned to their child's needs, it helps the child to develop the ability to regulate their emotions. They learn that even when they're upset, connection will be restored, that they're not going to be abandoned.
Right. Okay. And then on the flip side, when those relationships aren't good, the child might have trouble regulating their emotions.
Right.
Okay. And that can lead to problems later in life.
Exactly.
Okay, so we've talked about, diagnosis and some of the core concepts. Now let's get into treatment. The handbook talks about how there's been this movement away from more general psychotherapy toward more focused and structured treatment methods.
Right. So I think, back in the day, it was really more of a Freudian psychoanalytic approach.
Hmm.
And, more recently, there's been this movement toward evidence-based treatment. So treatment that has actually been researched. And, we know that it's effective. Right.
Okay. And some of those treatment methods that are talked about are CBTT, DBT, cognitive behavior analysis system of psychotherapy, pattern-focused psychotherapy, mindfulness, schema therapy, transference-focused psychotherapy, and mentalization-based treatment.
Wow, that's a lot of therapies.
Right.
So, we really have come a long way in terms of our understanding and our treatment of these disorders.
Exactly. Now let's zoom in on DBT.
Okay.
That's dialectical behavior therapy.
Right.
The handbook talks about how it's different from traditional cognitive therapy.
Yeah, so one of the main differences is that in traditional CBT, you're looking at schemas and you're trying to directly change those schemas. So those are those maladaptive thought patterns. Whereas in DBT, you're kind of looking at those schemas and you're validating them. You're saying, well, I can understand how you developed those given what happened to you. And then you're trying to help the patient develop skills to manage their emotions, to tolerate distress, and to have more effective interpersonal relationships.
Okay, so CBT is more focused on changing those thought patterns, and DBT is more focused on accepting those thought patterns and then learning how to cope with them.
Yeah, exactly.
And also improving your skills and relationships. Okay. Now, the structure of DBT is also really interesting. It has those 4 modes of treatment. Can you talk about those?
So we have individual therapy, skills training, phone coaching, and then a therapist consultation team.
Okay. What is phone coaching?
So, a lot of times people with especially borderline personality disorder are very impulsive, and they may have difficulty with things like self-harm, suicidal ideation. So the phone coaching is really for those times when the person is in crisis, and they can call their therapist.
Yeah.
And the therapist is not going to do a therapy session over the phone, but they will help the person to kind of get through that crisis and to prevent something really bad from happening.
Wow. Interesting. And then a therapist consultation team. What does that mean?
So therapists who do DBT meet regularly, and they consult with each other about their cases. And this is to help prevent burnout, because working with these patients can be very challenging. And it's also to make sure that they're adhering to the model and they're getting support.
Right. Because even the therapists need support.
Exactly.
So the handbook talks about how DBT is really effective for treating borderline personality disorder, particularly in women. But what about other populations?
So there's been a lot of research, and it's been adapted for adolescents, for people who are hospitalized, for people in forensic settings, and then also for people with other disorders, like eating disorders and substance use disorders. But I think one of the things that the handbook mentions is that there's not a lot of research on men or on minorities.
Okay. So we need more research on those groups.
Yeah, absolutely.
Okay. Now let's talk about the cognitive behavior analysis system of psychotherapy, or CBASP.
Right.
What is that all about?
So CBASP focuses on looking at how the client's interpretations and their behavior either help them or prevent them from getting their needs met. So it really looks at that kind of chain reaction.
Okay. So their thought processes.
Their thought processes,
Mm-hmm.
and then how those thought processes lead to behaviors that either work or don't work.
Okay. And the idea is to help them change their behavior so they can get their needs met.
Exactly.
And then the handbook talks about how, they also look at the client's motivation and their confidence in changing.
Yeah, because if they're not motivated and they don't believe that they can change, then it's not going to happen.
Yeah.
And I think, one of the hallmarks of CBASP is that a patient will achieve an expected outcome. And that's how you know that therapy is working.
Right. Okay, so let's talk about case conceptualization. The handbook talks about how this is so important for treatment.
Right. So case conceptualization is when we take all the information that we've gathered about the patient, we put it together in a concise summary so that we can really understand what's going on with them and what the best way is to treat them.
Okay. It's like putting the pieces of the puzzle together.
Exactly.
And then the handbook says that there are 4 components of a case conceptualization: diagnostic formulation, clinical formulation, cultural formulation, and treatment formulation.
Right. So the diagnostic formulation, that's where we're thinking about the diagnoses. how severe is the presentation. The clinical formulation is really getting at what's causing this. What are the underlying factors that are contributing to these problems?
Yeah.
The cultural formulation is taking into account their culture, their background, how that might be impacting their presentation. And then the treatment formulation is, well, what are we going to do about it?
Okay, so it's very comprehensive. It's looking at the person from all angles.
Yeah.
And then the handbook gives us a couple of examples.
Right.
Like Jerry Uri, who has avoidant personality disorder with some obsessive compulsive traits and also major depressive disorder. What are some of the main points of her case?
So I think one of the main things about Gary was that she had a lifelong pattern of social isolation.
Okay.
And she was terrified of criticism and rejection. And, she had this really, difficult upbringing. And so she kind of developed this belief that she was defective and that she needed to stay away from other people.
Okay. So she was really afraid of being hurt.
Right.
And so she just isolated herself. And
Wow.
the treatment goals were to help reduce her depression and to get her to go back to work,
Yeah.
but also to help her to build social connections.
Exactly.
Okay. And then another example is Kira, who has borderline personality disorder and also depression and substance use. So what are some of the key takeaways from her case?
So Kira was really struggling with mood instability, unstable relationships, and also self-harm. And, she kind of had this pattern of seeing herself as a victim and seeing other people as abandoning her. So she had this sort of like push-pull in her relationships where she would push people away, but then also she had this intense fear of abandonment.
Right.
Yeah.
And it sounded like her mother was very invalidating.
Yeah, exactly. So, she was really sensitive. And she had a lot of difficulty regulating her emotions, and so she ended up using substances to cope. And her primary treatment was DBT.
Okay. And the idea was that DBT would help her to, manage her emotions better and to build healthier relationships.
Right.
Okay. Now, the handbook goes on to talk about specific personality disorders in more detail.
Yeah.
So let's start with antisocial personality disorder. It talks about optimal, adequate, and disordered presentations. What does that mean?
So for each of these personality disorders, you can have a sort of a range. So there's an optimal, adequate, and disordered presentation. And so with the antisocial, an optimal presentation might be somebody who's very persuasive and charming. They may not be able to form deep emotional attachments, but they can connect with people. An adequate presentation might be somebody who is using their influence responsibly. They're acting with compassion. But then with the disordered presentation, this is where we're seeing the really aggressive, impulsive, manipulative behavior where they're really not concerned about other people.
Right. And they might harm other people and not really care.
Right.
So it talks about the difference between sociopathic and psychopathic personality.
Yeah. So, a lot of times those terms are used interchangeably, but in the handbook, they do differentiate. And the idea is that sociopathy is more influenced by the environment. So things like poverty, exposure to violence, inconsistent parenting. And psychopathy is thought to be more genetically based. And they also differentiate in terms of attachment and, guilt and remorse. So sociopaths are thought to be able to form some attachments and to experience guilt.
Okay.
At least for some people. Whereas psychopaths, they really have a pervasive lack of empathy and remorse.
Right. Okay. And what about the emotional style and the attachment style of somebody with antisocial personality disorder?
So their emotional style is often described as shallow. They don't experience a lot of deep emotions. They don't really feel guilt. And they're often seeking sensation, excitement. And their attachment style is thought to be a combination of fearful and dismissing. So, they see themselves as being entitled, but they're also afraid of other people.
Oh, interesting.
They see other people as being potentially exploitative, so they keep their distance.
Yeah. Okay, so the typical presentation is somebody who has a history of conduct problems in childhood and then grows into this, manipulative, ruthless adult who's really just focused on what they can get for themselves. Now, the handbook talks about how it can be really hard to interview somebody with antisocial personality disorder.
Yeah, because they can be really charming. And, if the clinician kind of goes along with their manipulations, they can be very engaging and very easy to talk to. But if they feel challenged, they can get angry, they can get critical. So, it's a very difficult dance.
Right. Yeah. And the handbook talks about how it's important to avoid being judgmental and also maybe even focusing on their successes and, what they see as their strengths.
Yeah, because you're trying to build a relationship with them.
Right.
But also, being very clear that if they become aggressive or if they're not cooperating, you're going to end the interview.
Right. Okay. And then for treatment, the handbook talks about the interpersonal approach. And this is about, trying to build collaboration and trying to interrupt those unhelpful patterns and encourage change. But it says that individual therapy is usually not enough.
Yeah, because a lot of times these individuals will manipulate their therapist.
Oh, okay.
If the therapist is too understanding, or if the therapist mistakenly believes that they have control of the situation. And, if the therapist is too confrontational, it can just reinforce their distrust and their defensiveness.
Right. So it's about finding that balance.
Yeah, it's about finding that balance.
Yeah.
It's about breaking through that kind of hostile autonomy.
Mm.
And that often requires a structured environment.
Okay. So like maybe a residential treatment program?
Possibly, yeah.
Okay. And it talks about group therapy, psychoeducational, psychotherapy, and support groups. And each of those has its own, goals and guidelines.
Right.
And then it also talks about involving family members, which can be difficult because these individuals tend to be very resistant to that. Yeah.
Exactly, yeah. They don't want anybody to know their secrets.
Right. Yeah, but the handbook says that sometimes involving family members can be really helpful for change.
Yeah.
Okay, so overall, the handbook is cautiously optimistic about treatment. It says that a combination of approaches is best, that it needs to be tailored to the individual,
Right.
and that time is also a treatment modality.
Yeah, because people tend to mellow out as they get older.
Now, that's good, yeah. And medication might be helpful for certain symptoms, like impulsivity or aggression.
Yeah, exactly.
Okay, now let's move on to avoidant personality disorder. The handbook starts by contrasting the avoidant personality style with the actual disorder.
Right. So somebody with an avoidance style might just really prefer routine and feel most comfortable with close family. Whereas somebody with a disorder, they exaggerate the potential difficulties in everyday situations. And they don't really have friends outside of their immediate family, because they're so afraid of being criticized and rejected.
Right, yeah. And some of those unhelpful beliefs are that they're inadequate, that they're socially isolated, they're constantly seeking approval from other people and putting other people's needs before their own.
Right.
And the key feature of this disorder is avoiding social contact due to fear.
Right.
And the handbook talks about psychodynamic conceptualizations of this.
So the idea here is that, the shyness and the avoidant behavior is really a defense against feeling shame and humiliation.
Mm-hmm.
And a lot of this comes from their childhood, their early experiences, and maybe even an inborn temperament.
Okay.
So that they're kind of overly sensitive to stress.
Yeah.
And they tend to misinterpret social cues. Even neutral cues they might see as negative.
Okay, so it's kind of like a self-fulfilling prophecy.
Yeah, exactly.
And then it talks about the cognitive behavioral conceptualizations, and this is where they talk about the core fear of rejection.
Yeah.
And that underneath that is this belief that they're socially inept, that they're not good enough at work or in school, and that other people are going to be critical and rejecting.
Right. And so the treatment from this perspective focuses on building trust with the therapist, helping them to challenge those automatic negative thoughts, helping them to change their core beliefs, and also helping them to gradually face their fears.
Right. And a big part of that is learning not to overestimate the likelihood of rejection.
Exactly.
And group therapy can also be really helpful for this disorder.
Yeah. So it could be a safe environment to practice their social skills and to, try out new ways of interacting.
Right. The handbook says that combining cognitive therapy with social skills training is really effective. And it also says that often a combination of cognitive and psychodynamic approaches is needed.
Right. Because, the core features of the disorder are avoidance and lack of trust. So it can be really hard for them to fully engage in traditional psychodynamic therapy. And it can also be hard for them to, do those kind of behavioral experiments in CBT.
Right. And the handbook says that sometimes starting with individual therapy and then moving to group therapy can be a really good approach.
Yeah, exactly. Build a relationship with the individual. And then once they trust you, then they might be more open to joining a group.
Okay, let's move on to borderline personality disorder. Again, the handbook differentiates between the personality style and the disorder.
Right. So somebody with a borderline style might have a lot of intense emotions, and they might be really sensitive, but, they're able to manage their emotions. And they have pretty stable relationships.
Okay.
And a consistent sense of self. Whereas the disorder, that's characterized by really severe instability. Their moods are up and down, their relationships are up and down, their sense of self is unstable. And they're very impulsive.
Right. And it says that the key feature is frantic efforts to avoid real or imagined abandonment.
Yes.
And it also talks about the role of abuse and neglect in childhood.
Yeah. So, there's a very high rate of trauma in people with borderline personality disorder. However, it's important to remember that not everybody with BPD has a history of abuse or neglect.
Right, so there are other pathways. Okay, so it talks about different theoretical frameworks,
Right.
including the idea of abandonment depression.
Right. So the idea here is that, they had these early experiences where they were abandoned. And that leads to this really deep fear of being alone.
Yeah.
And then also mentalization-based treatment. The idea there is that, these individuals have a hard time understanding their own mental states and other people's mental states. So the treatment focuses on helping them to develop that capacity.
Okay. Interesting. And then it talks about transference-focused psychotherapy.
Right. So that's a very structured therapy.
Yeah.
And the focus there is on helping them to, manage their behavior, to be more reflective, to regulate their emotions.
Okay. And then, of course, it talks about DBT, which we talked about earlier, and cognitive therapy.
Yeah. So cognitive therapy focuses on building a really strong therapeutic relationship, setting limits, challenging those core beliefs that a lot of these patients have, such as the world is dangerous, I'm flawed, I'm helpless, I'm always going to be rejected.
Okay, so really trying to get to the root of those negative beliefs.
Yeah.
Okay, now let's move on to dependent personality disorder. And again, a handbook compares the personality style with the disorder.
Right. So somebody with a dependent style, they might seek advice from other people, but they're still able to make their own decisions.
Right.
And they feel confident in their ability to do that. Whereas somebody with the disorder, they really can't make even everyday decisions without a lot of reassurance.
Right. And they really want other people to take responsibility for major areas of their life.
Exactly.
So some of those unhelpful beliefs are that they're inadequate, that they're overly reliant on other people, that they need approval all the time, and that they're sacrificing their own needs to please other people.
Right.
And it talks about the psychodynamic conceptualization of this.
So the psychodynamic view is often about a fear of loss, a fear of individuation, becoming your own person. And then the cognitive behavioral approach, focuses on challenging those beliefs of helplessness and also teaching them assertiveness skills,
Yeah.
So that they can stand up for themselves and they can express their needs.
Right. And it talks about the interpersonal approach. And it says that, these individuals might seem like ideal patients because they're very compliant.
Right. They'll do whatever you say.
Right. But the problem is that they might be doing that just to get more help.
Right. Yeah, they want to be taken care of.
Yeah, and that can actually prevent them from becoming more independent.
Right.
So the idea is to encourage them to act in ways that are opposite of their usual submissive role.
Yeah. Maybe be a little bit more assertive, a little bit more independent.
Yeah. And it also talks about involving significant others and maybe even setting limits on how much help they give the individual.
Right. So, if the person is actually functioning well, maybe you don't need to do as much for them.
Right, because that can actually reinforce their dependence. Yeah. And then it also talks about couples therapy. And it talks about, this dynamic of the dependent narcissistic couple.
Yeah. That's a very common pairing.
Yeah. And it says that it's important to figure out whether the dependency is coming from insecurity or whether it's just a lack of assertiveness.
Right.
To see if couples therapy is even appropriate.
Right.
Okay, let's move on to histrionic personality disorder. The handbook describes these individuals as often being very charming at first.
Right. Yeah, they can be very engaging.
Yeah, but then they can become really emotionally unstable and self-centered.
Yeah, and they need to be the center of attention.
Right, and it says that it's diagnosed more often in women.
Yes.
And what about their emotional style and their attachment style?
So their emotional style is very dramatic. They're very expressive, but it's often very shallow.
Okay.
They're very sensitive to rejection. Their attachment style is often preoccupied. So they're very worried about whether they're good enough. And their self-esteem is very dependent on what other people think of them.
So they need that validation from other people.
Exactly.
Okay. So the typical picture is somebody who's very attention-seeking, maybe using their charm or even being seductive to get noticed. And they have these very intense but shallow relationships.
Right.
And it mentions a couple of different subtypes.
Right. So there are those who are more controlling and those who are more reactive.
Okay.
So the controlling ones, they might be very manipulative.
Yeah.
And they're not very open to treatment.
Okay.
Whereas the reactive ones,
Right.
they're more seeking reassurance and approval.
Okay.
And they may be more open to treatment. They might benefit from empathy training.
Right. Okay. And it talks about some different approaches to treatment.
Yeah.
So psychodynamic therapy has to be very careful about the relationship between the therapist and the patient.
Yeah, because these individuals often develop romantic feelings for their therapist.
Oh, okay. Interesting.
And it's also important to help them to understand their projections, how they're projecting their own feelings onto other people.
Right. And it says that brief dynamic therapy can be helpful for people who are functioning at a higher level.
Yeah.
What about cognitive behavioral therapy?
So CBT focuses on helping them to identify and challenge their automatic thoughts. To really pay attention to their thought patterns, to challenge those core beliefs about being inadequate and being afraid of losing relationships. They work on developing empathy, improving problem-solving skills. And group therapy can be really helpful for these individuals because it helps them to, challenge that need to be the center of attention. And it also helps them to see their own patterns more clearly.
Right. And they might get feedback from other people in the group.
Exactly.
Okay. And then the handbook also talks about how these individuals often have trouble recognizing their own patterns.
Right, because they don't have a lot of insight.
Right. And they might also be really afraid of being alone if they become more independent.
Exactly. So you have to address those fears in therapy.
Okay, let's talk about narcissistic personality disorder. So this is characterized by grandiosity, attention-seeking, entitlement, and this fragile sense of self.
Yeah. So these individuals, they have a very exaggerated sense of their own abilities. They need a lot of admiration. They feel entitled. And, underneath it all, they really have very low self-esteem.
Okay.
And they have a lack of empathy, which often leads them to exploit other people.
Right. And it mentions that there are different subtypes.
Right. So there's the self-centered, impulsive type. There's the ruthless impression management type.
Yeah.
And then there's the acceptance-oriented type. And those who are more acceptance-oriented tend to do better in treatment.
Oh, interesting.
Yeah.
Okay. And then it talks about some of the different treatment approaches.
So we have psychodynamic approaches, which might focus on, healing the sense of an incomplete self. There's supportive psychotherapy, where you're really just trying to help them to manage their narcissism in a more healthy way.
Okay.
There's group therapy, which can be helpful because they get feedback from their peers.
Right.
But a lot of times they drop out of group therapy.
Oh, yeah. Because they don't like being challenged.
Exactly.
Yeah.
Yeah. And then couples and family therapy can be helpful because, you're addressing those projections, that tendency to blame other people.
Yeah.
And you're trying to improve communication within the family.
Right. Okay. And it says that often a combination of approaches is needed, especially to address any other issues that they might have.
Right. Because a lot of times they have depression or anxiety, as a result of their narcissism.
Right. Yeah, that makes sense. Okay, let's move on to obsessive compulsive personality disorder. So this is the inhibited, stubborn, perfectionistic, and anxious presentation. And it's important to distinguish this from OCD.
Right. So this is not about having, the obsessions and the compulsions. It's more about being a perfectionist, being very rigid, needing to control everything.
Right. So
Yeah.
the typical presentation is the perfectionist, control freak, who needs every detail to be just right.
Exactly. And they have a lot of trouble delegating.
Right.
And they're very rule-bound.
Okay. And it mentions some different theoretical perspectives.
So from a psychodynamic perspective, the idea is that underneath all this control is a lot of doubt.
Oh, okay. Interesting.
And the biosocial perspective, talks about how this might develop because of parental over-control.
Oh.
Or learned behaviors, or maybe just this overdeveloped sense of responsibility.
Okay. Interesting. So the handbook says that in an interview, these individuals might be very guarded.
Yeah, because they don't want to reveal anything that might make them look bad.
Right. And it says that group therapy can be helpful because it diffuses the intensity of their interaction.
Right. And it also reduces the transference issues.
Right. And it encourages them to take action rather than just talking.
Exactly. Yeah. And, the handbook also mentions that tailoring the treatment to the individual is really important, especially for the more severe cases.
Right. Yeah. Okay, now let's move on to paranoid personality disorder. So this is the distrustful, secretive, and isolative presentation.
Right. So these individuals are very suspicious. They're mistrustful of other people. They tend to be secretive. They're isolated. And their emotional style is very cold, very lacking in humor. They're very quick to anger and jealousy.
Okay.
Their attachment style is fearful. So they really expect to be rejected.
Right. So they're constantly on guard.
Exactly.
And it mentions that there's this link to paranoid compulsive patterns, and that their rigidity and suspiciousness kind of keeps this going.
Right. Yeah. And it's hard to treat.
Right. So it talks about psychodynamically oriented therapy, and this requires a lot of empathy, a slow pace, limited goals,
Right.
and also using something called dialogical self theory.
Yeah. So that's the idea that, we have multiple cells.